first, then Professor Tiong, then we'll open the floor, right? Take some questions and comments, because my professor, actually from that university, I was graduated, Professor Sayyada Sultana Parveen. She is my honorable professor. She is here in the dais, in the seat, and categorically she actually communicated me. Madam told me to love to talk and get some voices from Malcolm lively. Though Malcolm, your video is with us. We will play the video after your introduction. So, Madam, are you here?
Yeah. Hello, Malcolm Payne.
Madam,
Hello.
on your video, please.
Yeah. Okay.
Spread video.
Just wait. Yeah, can you see now?
No.
Not yet. Okay.
Not yet. Yeah.
I'm trying. Well, it's my great pleasure that I'm watching, and I have a course, you know, on globalization and the book of Payne. It was very, very helpful, and so many informations within that book, and very interesting and full of information, and what is going on, what are the postmodern problems, what is inequality, and impact of globalization. So I found it's a very helpful textbook for our students in this university. So I'm feeling honored myself that I'm watching him, and maybe I will talk to him later on the connections between theories and application of social work and international social work. Thank you, Habib. I think you will see my photo. You will see the video. It is some problem. I have got some problem. Well, thank you. Can you see me now?
Yes, but no video, no audio. You need to
Not audio. What's the problem?
Great.
So, can you hear now?
Yes, that's good.
Okay, thank you very much. Okay, that's all for today, and then I will talk to you later and with everybody, every participants.
All right, thank you, Madam. I was talking to Professor Tiong. He just joining. Actually, he commenting me that he was in opening, but I requested him to join again on the session. He's joining right now. So Malcolm, really we are very honored, and this is first time here in Bangladesh. You know, in the opening session, we were in live, but in directly in the link, more than 80 from different parts of the world, scholar, social worker, academician, practitioner joined around the world. And I didn't disturb you because it was actually late night or early in the morning, too early in the morning, if I requested to join the opening session. That was really amazing session. And you know, our conference will be on up to 6th of April. Total approximately around 140 research paper, experience, case studies, field studies will be shared with 2 keynote sessions, 3 plenary sessions, and 14 technical sessions. So people will join together, and we are trying to just bring social work in a place where people will get the real definition of social work, because we sometimes hear people, everybody loves to say I'm a social worker, but I agree with that, but we're not clear about the definition of social work. So gradually we're just keeping, you will be very happy, you know, since 2014-15, we have been celebrating World Social Work Day in Bangladesh very colorfully. Even this year also, with my volunteer, my colleagues, we have celebrated keeping the health safety measures. We celebrated World Social Work Day, have a workshop on it, and we have been just keeping on. Mariko is here. Mariko always inspired us, really. She boosted us, come on. And I commented to Mariko in 2015, the Bangkok conference, that I definitely am committed to do something for social work. As my professor is here, my teachers, my colleagues, my friends and volunteers are here, we all together keep a vibration for a resilient community, sustainable community, implementing social works, ethics and values. Actually, that is our motive, and you will be happy to know, all of you, during this COVID pandemic, we have started a wear mask campaign since November 28 in Bangladesh. Already out of 64 districts of Bangladesh, we have covered up to 24 districts. It's on, and if COVID, if myself and with my volunteer are safe, we will be on just announcing with a mic, just symbolic mask, just to aware people to use mask. You know, it might not protect us, but it might give us initial safeguard. That's why that is our motive. And already we are 10 minutes over our time, running up time, but I'm waiting for a few other guests. As for time difference, in many countries, this is midnight, late night. Actually, it's very difficult to. So, Honorable Chair, Mariko, should you start our session? Mariko?
Yeah, well, let's make a start.
Okay. Mariko?
Yes.
May I have your kind permission to start our session and let Tiong join later on, as
Okay.
Tiong will speak second speaker?
I think that's fine.
All right. Thank you. Good noon, everybody. Distinguished scholars, guests, presenter, participants, speakers, and honorable session chair. As you know, we have already opened our session today, just sharp at 10 a.m. Bangladesh time. And this is a recorded video. We'll share it on YouTube later on. We'll share it in GISW, that is Global Institute of Social Work platform. We will share it. You could see that it will be shared in other platforms. So the recorded video will be shared. So greetings from my side, myself, social worker M. Habibur Rahman. Actually, that is my eternal dream, to establish this name before my name, before others' name, as a social worker. As a promising social worker, I love to say social work before my name, rather anything in the world. So that is my commitment, that is my compassion and sincerity. So my regards to all of you. You will be very happy to know, in the session as a keynote speaker, two very renowned professor, vibrant professor. One is Malcolm Payne. Actually, he is self-explained. I shouldn't speak more about him. You know, many books are here of Malcolm Payne, but just let me say a few words about Malcolm. You know Malcolm very well. Currently, Malcolm Payne is an Emeritus Professor at Manchester Metropolitan University, and he is Honorary Professor at Kingston University, London, St. Gregor's University of London, and docent in social work in Helsinki University, Finland, and many other involvement. Actually, Malcolm has. It will take time to speak about Malcolm. He was formerly Director of Psychological and Spiritual Care, St. Christopher Hospice, London, has worked in local community development in Liverpool, policy and mental health service development across the UK, as well as many different forms of social work practice. His recent books, among his many books, but recently published list includes How to Use Social Work Theory in Practice, an essential guide that is published by Policy Press 2020. That is the recent book of Malcolm Payne. Another book is Modern Social Work Theory. Belgrave actually edited, published that one. Book on older citizens and end-of-life care, social work practice strategies for adults in later life. Actually, dear ladies and gentlemen and distinguished scholars, when Professor Sayyidah Sultana Parveen speak about Malcolm, actually Madam introduced him, so I shouldn't go more for him. I directly come to Malcolm, and Malcolm, yesterday I just emailed him. Malcolm, we're eagerly waiting for your live voice, not the video. Actually, I'm honored to have you here directly in person. As you are here, as you send a video, we will try to play your speech on the video, but after that, we'll ask and come back to you a few questions. Malcolm, is it okay?
Sorry, I'll unmute. Yes, that's fine. I think you get the more succinct version by listening to the video, and then we can talk about things that people want to ask.
That's great. That's great. And so we'll go on the speech of Malcolm with the permission, and I'm just giving the floor to Honorable Chair. Chair will operate the session. After Malcolm, then Chair, you could decide, Professor Mariko, then we can have some questions, and after that we can definitely come to Professor Tiong's speech. Tiong also sent a presentation video. By this time, Tiong will join. And I could see in the screen, Ponom, I could see Dr. Shakti Prabha is here. Hello, Shakti. And from Philippines, Adi Pinjon joined, and many other friends, colleagues, students, graduates already joined here. My colleagues are here. So the floor is totally for Honorable Session Chair, Professor Mariko Kimura. And before coming to her, just a minute, I should introduce Professor Mariko again. She is a very lovely professor. She inspires me always. Professor Mariko, currently Emeritus Professor of Women's University of Japan, and she is immediate Past President for 2 times of International Federation of Social Worker Asia Pacific. Now she's the chair of Japanese Federation of International Social Worker. And I should say a few words about Tiong. Tiong is the professor of Japan Social Science University, and Professor Tiong currently the chair of GISW, Global Institute of Social Work. And that's all. Mariko, this is your turn, please. When you declare, then we'll operate the video of Malcolm, please.
Yep. Thank you very much. Let's start the session. Thank you, Dr. Malcolm Payne, speaking at this conference. Let's start.
Hello, my name is Malcolm Payne, and I'm delighted to make a contribution to your conference today on the theme of connections and connectedness. This is a really important idea in social work, and I want in particular to talk about the connections between theory and practice. And I start, when I think about this, with the global definition of social work created by the international associations concerned with social work and social work education. There are a lot of things in the definition, but I focus on the 3 objectives of social work, because you can't understand how you should practice social work unless you can think about your objectives. And the 3 objectives that the global definition provides for are social change and development, to create social cohesion, and to try to achieve empowerment and liberation of people. That's people collectively and people as individuals and in their families and communities. All of these objectives are about creating connections between people and improving the social networks of people in their families, communities, and their society, and connect the connections, the networks between organizations in society. And increasingly we talk about the idea of social capital. The idea of social capital is that the more links you have, the more chance you have of having a satisfying set of relationships and a satisfying life. So if we take that and look at social work with that idea in mind, you can see that connectedness is an important idea in all kinds of social work. And it's an important idea in doing social work and using ideas in social work. But when I talk to people about using ideas, using theory in their practice, or indeed how their practice makes them think of the ideas that social work is involved with, I very often get this picture, which is rather like there are two countries. There's theory over there, and there's practice over there, and there's this bridge between them, which has to connect them in some way, and there's a long distance to travel. Well, I suggest that we have not set up social work very well by creating these different groups of people, of practitioners and managers of services, and theoreticians and researchers who create ideas which should apply to practice. There is overlap. People do make connections, but the connections don't work very well. And so I think one of the things we must try to do is to find ways in which practice, experience, and wisdom from practice can have an influence on theoretical ideas, and that theoretical ideas can be grasped by practitioners in ways that are useful to them. I see that there is not one social work, but there are a range of social works which try to achieve rather different conceptions of what social work is all about. And you find these different conceptions of social work in different parts of the world with different emphases, and that is because the political and cultural history of those different parts of the world have led us to different kinds of social work. So I identify currently 4 social works that are around the world and having some influence on how we're thinking about what we do. The first is what we call social work, and this is a set of concepts in which we try to help and care for people in an interpersonal way using all sorts of techniques. It concerns relationships and the development of social capital in fairly small communities and in interpersonal relationships. A second view of social work is what I call social assistance. So this is very much a service delivery sort of approach to social work, and is particularly typical of countries where there's a welfare state. In other words, the state takes responsibility for quite a range of social welfare provision. It doesn't exclude the social work help, because very often people need to be helped to use social services and to make the services relevant to their personal needs. The third concept, also European, and in some ways much more widespread than that, is what the Europeans call social pedagogy. And in some European countries, this is a separate social profession from social work. You have social workers and you have social pedagogues. And this is a conception of social work which is about education. It's about helping people learn to be successful members of their community. The fourth area of social work, fourth kind of social work that we have, is increasingly influential and important, and it's generally called social development. And it's particularly strong in Asia and Africa. And what social development tends to do is to say, helping and caring is not enough. Yes, you need that available. Providing assistance and services to people, yes, you need that too, and you need it to be available. And educating people is good. It increases their capacity to contribute to society, but it's not enough, because the society has to organize itself in order to enable people to make these contributions to social capital. And it's about getting people to come together to make those contributions and to change the society so that it will develop those contributions. And what we're seeing in recent years is an explosion of theoretical development in Asian countries and in African countries to try and reconceptualize social work away from the traditional views of community development and the traditional social works of social work, social assistance, and social pedagogy. And these new, what I call 21st century perspectives on social development are very much more concerned with how the society is changing, guiding, directing, pushing, shifting the developments that are going on. Social change and social development comes about because of economic demands and global changes in the world. And you think about climate change and environmental change. This is a global shift in thinking which is going on, which social work and social assistance and social pedagogy and social development is part of, but it's not the only driver. And you think about human rights and responding to those, and you think about, in particular, the position of women and inequalities in their position. And the reason why there's been an emphasis on women is partly theoretical. It comes from feminist movements, but it's also an immensely practical movement, because women form an important economic base which is neglected in conventional economic thinking. They create an economy which is based on the social and which is not taken account of in ideas of economic development and physical development in societies. So what you're getting is an explosion of conceptualizations which want to shift the talk towards how we can develop connections which respond to the issues which people are seeing as really important globally. And this is why international social work has begun to shift from trying to get people to respond to the ideas that have come from social work and social assistance and social pedagogy, to think more about how all social work can respond to the global issues that as societies and that as human beings we all face. And to suggest that social professions can't make the only contribution, they can't even make the running, but they make an important contribution because they have this conceptualization of social concern, releasing, empowering, liberating people to take part in social development and to contribute to social change. Not to make social change, not to direct social change, but to be a part of social change. And it makes a connection between the ideas that we get from social work, social assistance, and social pedagogy with the ideas that we must create shifts in the way we achieve social development. Well, thank you for listening to that, and I do wish you a successful conference in thinking about these and many other ideas which contribute to building connections within social work.
Thank you very much, Dr. Payne. You provided very critical points for us to think about the social work in the past up till now and how we will respond to the present change of society and connectedness to the global issues, and how the social work in different parts of the world can somehow connect to each other to respond to this global change happening at the moment. So Habibul, Professor Habibul, shall we ask next speaker to speak first, or how are we going to do this? I think.
All right, Prof. I could hear you. So thank you, Professor Malcolm Payne, as you were here for a wonderful speech. And Professor Tiong is here. Hello, Tiong. How are you?
Hello.
Hello.
Can you hear me?
Yeah, we can hear. We're very delighted to have you and Professor Malcolm Payne both. We're really we're eagerly waiting for both of you. As Malcolm's speech is over, Honorable Chair, Professor Mariko, we can actually do two ways. One is it might be we might have some questions instant right now, or we might have questions after Tiong's speech over. That might be better, I think. What do you think?
I think to have Dr. Tan speak first and then have a question and answer and session. What do you think? Shall we do that?
And before coming to Professor Tiong, actually Tiong, we have mentioned many times that Tiong is coming. Professor Tiong inspired me a lot. Currently, he is the professor of Singapore University of Social Science and Honorable Treasurer of International Association of Schools of Social Work and Chair of Global Institute of Social Work. So as per recommendation of our Honorable Chair, Professor Mariko Kimura, we can proceed to the discourse and the lecture of Tiong. Then after that, Mariko, we might come to open floor, right? Is it okay?
Yes, that's fine.
That's great. That's great.
Well, good afternoon.
Can
you see me all right?
Yeah, all right.
Okay. Well, it's my pleasure to be here at the 4th International Conference on Strengthening Social Solidarity, Community Resilience, and Global Connectedness. We have been friends and colleagues with Bangladesh and with the network here, and we certainly believe in the social solidarity. And what I wanted to add is how social resilience and human relationship can work towards social inclusion and social development. So that's the topic that I like to share today. Is the screen all right? Screen is okay, and we will.
We can see.
Okay, I think I will put it as a slideshow so it'll be bigger. The impact of social integration and social development. what we wanted to see is that social resilience, which is the ability of individuals, community, and society to adapt and to bounce back in the face of calamities such as COVID-19, is important to build community and enable social development. And then we want to look at how people adjust and adapt as a sign of resilience. That will be important for social integration. So social relationship in a nutshell enables social resilience, and social resilience depends on a social network that empowers it. So this is important because we want to look at underlying value basis of social relationships. As we all know, human beings are social, and because of that, we need social relationship not only for survival, but also for progress, for building a more civil society. And we need to have key values that underlie these theories of social resilience and social capital for social integration. So what are these key values? I believe that values identify who we are and the nature of our relationship. What Malcolm's saying, ability to join together, to work together in terms of care and support for each other, ability to participate in a group setting, to not steer direction, but also be part of the movement towards the goal of humankind, which is a quality of relationship that makes us like a community, like a society that is integrated, caring. So social work has a particular mission for social inclusion of the poor and marginalized people. And the basic value that we subscribe to is that all are created equal and we are all worthwhile, and no matter what stations in life we are, there is respect and human dignity. And I think this is universal. So for social inclusion, inclusion is the systematic process of mainstreaming marginalized population. It is building on not just the bridging capital, but also the bonding capital that Putnam talks about. And these are strategies for empowering persons so that they can participate in their own situation in life, for poverty alleviation, for societal programs. And these values in social resilience and development, including social inclusion, participation, as we have said, the dignity, worth of people, is based on the idea that all human beings are worthwhile and have strengths, and we should focus on how they can develop using their capacity, using their strength, so that we can form a more cohesive and more inclusive society. So social resilience is then the practical steps by which we bring about the values of engagement, empowerment, capacity building, collaboration, the value of diversity and inclusive action. In it is also the idea of social protection, and I would not go into it, but basically social protection, including social justice, income security, quality education, healthcare. These are functions of social protection to reduce poverty, to encourage growth, and to have social investment for development. So we see people as contributing to society. I just, in this short presentation, want to present a model by which we understand how marginalization occurs, and then I will present a model of how we should go about social inclusion, and then quickly summarize and say, how do we go about practice? So if we look at marginalization and social resilience, we know that there are factors that contribute or push one into being a marginalized population. And that is some of the barriers of exclusion, like a person is socially isolated, they don't have social networks, so no contact with the outside, or they have social psychological barriers, or they don't have economic access, no opportunities, or they are technological barriers. So that gives us a hint how we can go about practice already by reducing the barriers to exclusion. The other side of exclusion is the political and economic exclusion. And it is being not included in decision making. There's no choice. You are forced into a situation and you are disenfranchised and sidelined. Economically, low wages or no wages at all, job insecurity, selective recruitment, or discrimination. So all this actually adds to lack of social protection because countries do not conform to the rights and convention, or the protective factors in the policy and programs are not meted out and services are not present. So how does social resilience come into it? Social resilience builds social capital that brings about inclusion, and therefore the values there in terms of empowerment, capacity building, resourcing, networking, support is important. Let me quickly go into a model of social inclusion. And I think this is what social work practice is about. We want to bring about an inclusive society. So in the ecological context, in the chrono system, in the life transitions, in the adaptive changes, to bring about changes in the behavioral, the values, the relational, the structural systems. And all this at the individual to the macro system, the micro to the macro, the interactional, interrelational, systemic, and societal institution. So we are talking about social intervention at various levels for social resilience and inclusion. So therefore, the approach to social inclusion starts with what we value. And I said the basic values, relationship and communication, and that's the theme of our conference, really, is connectedness, building relationship, building a network, and based on equality, based on justice, and based on respect for each other with strengths and social responsibility. And we can see we have a lot of respect for Bangladesh, for what Habibo is doing. I think the value here is that the social work community, even at a larger frame, should be more inclusive, and we can work towards that. So in the model that I have presented in terms of social inclusion, we can start with the family and informal level, strengthening relationship, bonding, cohesion, financial, social, psychological support, moving into social cultural element of community participation, social cultural access, and towards the policy level at the societal level, which we have mentioned in the previous. So how are mainstreaming strategies brought about? I would say the government, the societal structures have to mainstream in terms of human capital development and as well as social capital development, training and education, recruitment, employment, access to technology and skills training. And so we are systematically integrating inclusive society. And this model then brings about connection between groups and between groups and within groups. And therefore we can produce positive social change and strategic social inclusion. So building of social capital, building of structures to involve people, participation at the community level, at the organizational level, at the family level, at the individual level. So this is important for social integration, and values play a key part in moving towards a society that is discriminatory, practice-free, marginalization decrease, and therefore a more inclusive and progressive society. So with that, I want to thank you, and I wish you the best. And please join us also at the International Associations of Schools of Social Work, as well as the Global Institute of Social Work, where I am the chair. And good to pass it over to my good friend, Mariko.
Thank you very much, Dr. Tiong. So the terms connecting Dr. Payne's lecture and Dr. Tiong's lecture is how to connect various functions in the realm of social capital to mobilize the society and the community forward by social work. Shall we open floor for questions?
Honorable Chair, Mariko.
Yes.
I could see some faces here. Dr. Shakti Prabha from Chennai, Poonam Gulalia from Delhi, Sayyida Sultana Parveen from my university, Bangladesh, Dr. Ismail Hussain. So on behalf of you, may request them to say a few words. It might be questions or it might be comments or anything or feeling sharing. And Dr. Shakti is here. Could you hear us, Dr. Shakti Prabha? Professor Ismail Hussain is here. Sir, could you hear me? And Sayyida Sultana Parveen, madam, if any one of you, actually Mariko asking, as we have time, enough time, in half an hour.
I think so. And Professor Habibu, you know the audience, so
Can you hear me?
Yes, madam, we can hear
Hello?
you. Yeah, madam,
Okay.
we can hear you. Yes.
I have a question. I have a, not question, but sometimes I think in this way. So I have a question to Payne that he told that the theory can grasp by the practitioners. We are the educators in the universities, and practitioners are they are practicing in different geos and NGOs. Well, so there's a gap now. How to connect these two parts of international social work? One is theory, another is application. So one needs to know the theories, but only the educators have the idea about the theories, not the practitioners in our country especially. And probably in Bangladesh, the progress of social work, it is within the boundary of the universities with the educators, not with the practitioners. And it is not practicing widely. It has not got a very wide range of performance on functions or activities. So Payne, do you have any suggestion for us that there's a gap? So who will take the initiatives to show the message, the mechanism, the components of theories, because we have a distance with the practitioners and we people, the teachers. So so do you have any suggestions for Bangladesh? Because yes, we have some sort of um, uh, um, for providing welfare activities in Bangladesh, there is some financial problems. Well, and with addition to that, I was in London for 5.5 years. So I was there in London. I have seen what is welfare state, what are the functions of welfare, what is social assistance. And it was very amazing to see welfare activities. So whenever I come back to Bangladesh and found different types of problems, socioeconomic problems relating to basically with finance and then with ego problem, psychosocial problem, that is the after effect of globalization. So Payne, do you have any suggestion for Bangladesh how we can overcome the gaps? Well, this is I just want to know, do you have any suggestion or any planning or any design or any structure?
Well, if I may make a start to unpack some of those, that's a very complex set of ideas you're talking about there. I think the first thing I want to say is that no activity is without theory. So that even if a person is practicing without an understanding or an appreciation or deep knowledge of the formal written academic theory that is debated in academic circles, they still operate by a theory. Yes. And it's, even if it's an informal theory, even if it's hidden, unexpressed and unknown to them in an intellectual expression, people are using a theory. So one of the important things to do is to understand the ideas which inform people's action in the world. So every practitioner is using a theory, even if it's unexpressed and not directly connected to academic concepts. But the second point about that is that, of course, the informal theory that practitioners are using derives from the culture and traditions and the needs and expressions that they are part of in their practice community. I think Professor Tan has made the very important point that it is the values that inform practice which are going to respond to the kinds of developments that we want to see in breaking down the barriers that he's talked about, increasing the resilience that he's talked about. And one of the things I think I'm very strongly aware of is that in our societies, we are not in control of, we are not directing, we're not managing the values which are expressed in our social relationships. And so the values that Professor Tan has set out for us are not expressed in many of the communities that we work in. And the importance of his expression of those values is to show to us the way in which we must try to influence the direction of social change so that they express more of the value system that he has put forward. I think the difficulty is that I see around me the expression of a set of values in our societies which do not create the kind of value system that he talks about. So if I think about resilience and I look at what the social agencies in my country are doing about resilience. Really, what they are trying to say is resilience is people's capacity to call on their community to respond to the difficulties that they face. But the problem is that people who are in poverty have only poor communities to call upon, so that their resilience, the claim to produce resilience in those communities is creates its own barrier, because they say to us, well, get your resilience from your community, and yet this is a community which is already containing much poverty and many barriers. And so we have to introduce the kind of values that Professor Tan has talked about, so that the system of values in society is not hostile to people in poverty, and which enables them to strengthen themselves both from within, yes, but also with all of us contributing to that. So we have to have broader social links which contribute to resilience, not just the resilience of individual communities. And I believe that a political system which says resilience comes from the person and resilience comes from the community is not sufficient. Resilience also comes from the wider engagement of society in dealing with the social issues that society faces. And there is resistance. And globalization is an expression of that. There is resistance to using all the resources of the community to develop it in directions which respect the range of values which are in our societies. So I don't think we can be, imagine that our values are going to be the only ones that that affect social change, because there are very negative responses to social change which we have to engage with. But we have to accept that there are these negative values, and we have to try to influence those values with our own conception of how a society should be. I think that's one of the important things that we can do in promoting resilience in a society. I'll shut up and let other people talk about it.
Madam Chair, may I just jump in here? I think Saida has a very exciting, interesting question that most practitioners ask. I taught a class called Theory Building in Social Work Practice. And in it, basically, we want to know what practitioners do and how they actually theorize from their action. So they are the ones who actually build theory. We call this grounded theory. But the essence of what Professor Malcolm has said is that there is nothing so practical as good theory. You must have good theory to have good practice. How you understand the conception of practice from the values to the practitioner's action to the engagement process to the outcome of the intervention is already a theoretical frame by which you practice, whether you consciously articulate or not. So the whole idea of grounded theory is to build what we call effective and efficient practice that is based on ethical considerations and practice values. And that forms the theory base for whatever practice you are doing. And it must be contextualized, as it is said, into the local situation, into the agency context. And part of this approach as change agent is perhaps to change some of the agency's practices and procedures that are detrimental to the client's welfare, to enable clients' resilience and be able to access resources beyond what they are able to. And that's where social resilience is built. So that is my perspective of it. Thank you so much, Professor Malcolm and Saida, for that question.
Thank you, Tiong. Thank you very much.
Thank you.
Okay, Habib, I think you can talk now.
Well, thank you, madam, for your raising wonderful comments and good supplement from Professor Malcolm Payne and Tiong. There are many participants, and Poonam Gulalia is here. Poonam, Dr. Poonam, would you love to add 1 or 2 minutes points or any comments?
Thank you. Yeah, thank you, Habibur, and to the chair for allowing me to add 1 or 2 comments after Dr. Payne and Dr. Tan have spoken, because I would have been coming across differently. But when Dr. Payne was talking about, as practitioners and as academicians, we tend to bridge the theory practice linkage. I, pat myself on the back like Habibur does sometimes, or more often than not, that we've been practitioners longer than we've been academicians. So we had the advantage of what Saida and Dr. Tan also said, of recalling the wisdom that we've gained over the years, the experience that we've gained, and using that as practice knowledge when we relate to our students and our communities. And one small thing I want to add for Habibur is that I am so grateful to you for getting us Dr. Payne and Dr. Tan on the virtual platform today, because reading about them and reading about their work is very different from hearing them today. And thanks to the chair as well for pulling it all together and giving us a space to network further. Thanks very much. I appreciate it, honestly.
Thank you, Dr. Poonam Gulalia. She adds a few points very nicely. I could see, Kim, I will come to you after 2 or 3 participants after. I could see Mr. Abul Kashim. He is DMD of PKSF. Mr. Abul Kashim, could you hear me? Mr. Mahbubur Rahman is here. Urmila Ghose, anybody, the floor is open. Nikhil Kumar, Elizabeth, Alexandra, Elizabeth, would you like to add any comments? So Mr. Suhail Khan is here. Actually, virtual platform gives us many things. One is switch off the video. This is a good item, and mute, unmute. This is additional insertion during this new normal situation. So always I do that, in fact, and I'm just facing this reverse. So Kim.
Madam Chair, and
sure.
Can I ask a question of our honorable speaker, Professor Payne? You were alluding to the fact that modern or 21st century social work must take an international perspective. Did I hear that correct? Or what do you mean that we need to actually go into a different level of practice?
Well, I think that the first thing to say is that international social work, I think, has changed within the last 20 years. And it has shifted from a conception that what we're trying to do is to expand the influence of social work across the world to places where it isn't, because it is more or less everywhere now. And what we have to do in international social work is, first of all, to draw together the different conceptions of social work that exist in different communities. And because of linguistic difficulties, and problems of traveling in the 20th century, it was much more difficult to gain a conception of how people were thinking in different parts of the world. And I think that is more available to us now. But I think the way in which international social work has changed is that, and I think this concept comes from Japan. The view is that you have to look at global issues rather than, and how those global issues make an impact locally, than to look at the local issues on their own. Because I don't think, for example, you can understand the economic inequality in the position of women, which I was talking about, without understanding that the economic theory doesn't give a proper place for the social contribution and the economic contribution of women to our economies, because economic theory just doesn't take into account the kinds of work which women contribute to the economy. It doesn't measure them, and I think one of the things academics offer is the concept of measurement and research as a way of expressing the contribution of individuals and communities. But I think until we identify how we can locally respond to these global issues, we cannot begin to make our local contribution relevant. I think until we think about how the climate change is affecting the whole world, how the position of women and inequalities is affecting the whole world, how injustices and changes in social values are affecting the whole world. Until we can understand the global perspective on that, we can't begin to implement that locally. And so we have to think about that international, those international movements in order to understand how we can act locally. As people have always said, think locally, think globally and act locally. Well, I think that's the right way of conceiving it. You have to see where the shifts in ideas and the shifts in importance are in the world in order to think how you should change your own part of the world locally. And I think a local group of practitioners, I think it's very difficult for individuals to make this contribution. I think local groups of practitioners, local communities of practitioners, as Dr. Rahman is trying to achieve in Bangladesh. I think everywhere there are groups who are beginning to think about these global issues and how this can be worked on locally.
Yes.
And if Habibur was talking about his campaign, the campaign of his organization to look at mask wearing. Well, if you think about that locally, yes, you've got to influence people to look after themselves and create safety in their own community by mask wearing. But what does that say about the global issue of the way in which health is affected by global shifts? We learn this from the pandemic at the moment, that a global change is going to affect us locally, and we've got to respond to it according to our own traditions and our own cultures. And we can learn from other people's cultures in order to do that locally as well. So there's tremendously exciting opportunity for learning from the world how we can change locally.
If I may interject here also, that I think the global connectedness is definitely the trend, and environmental issues are all globally relevant. But I think resilience is built at different levels, and therefore you need to respond to it as a society. So in the pandemic, how we respond as a society, how we respond in the community, and then how we done it at the individual level. So social work's intervention is simultaneously at all levels. But I think we must be able to say, where is our priority in terms of the intervention? And we may not need to wait for international bodies to do it. In the local community in Wuhan, they already started when the COVID-19 pandemic, they started helping each other and building resiliency. And then social workers also contributed. So that is at the more local community level, but the societal intervention is critical towards building the infrastructure for the community to move forward. So I would agree in some ways, we need to look at how the global intervention, but we cannot wait for international bodies to move. We need to move at various levels to build our resiliency. And so I think we are probably on the same page, but worded differently. Is that correct?
Well, I think I agree with that, but I think one of your contributions, I think one of your contributions, and also Professor Desai, who is to appear later in the conference, I think. I think one of the important contributions you have made is to express the importance of a national conception, a regional conception, and a local conception of values and priorities, informing how you use these more high-level general values in a particular way in your own community. But what I warn against is what I see in my own country, and that is a conception that you can just leave it to the local people, because a community in poverty does not have the resources to respond to global issues. It is important to call upon the responsibility of international bodies, global bodies, and regional bodies, and national bodies, and local bodies, all together to deal with the issues that we understand and face. And one of the contributions of theory and of the academic world is to create the ideas and to research the possibilities that we can use to contribute to this international and local way of working.
Thank you. Thank you, Prof. Honorable Chair. Our time still, we have 15 minutes. So may I request Honorable Professor Dr. Ismail Hussain, sir, are you here? Can you hear me, sir? For any comments, sir, or any comments or any addition with wonderful discourse from Malcolm Payne and Tiong. Excellent, actually. We love to hear you, both of your lecture. Amazing, amazing. That Professor Sayeda Sultana Parvin Madam already mentioned. So Kim, Suppi Kim. Kim, are you here? Can you hear me, Kim? Kim is here? Okay, okay. Kim, you can just comment on the session.
Right, just no, I don't have any question.
Habib, can I share?
Yes.
Okay.
Madam, for you 2 minutes, Madam.
Okay,
two
okay,
minutes.
okay, it's all right. Okay, it's all right. I was just listening, Professor Payne and what Tiong was telling. So right at the moment, I'm thinking that for Bangladesh, professional identity is very important. If we can ensure the professional identity, that can make a fruitful field and mechanism for Bangladesh, and in that way, professional social work and international social work with its mechanism can work properly, this can function, because the way we want, it deserves the theories and methods of core social work, not the combination of anything. So I think professional identity is will be the solution. Thank you. That was my ideas. Thank you very much.
Thank you, madam. Thank you. Dr. Ismail Hussain sir is here. Sir, would you love to add any points or any comments, sir?
Okay, thank you, Habib, for organizing such wonderful conference. First, I would like to congratulate Professor Malcolm Payne for his wonderful presentation on theory and practice in social work. I would like to mention just one thing about, just for thinking to Professor Malcolm Payne. This is about, if we think about the emergence of the history of social work, actually it was started through the intervention of the labor class community. And later, considering the situation of the labor class community, COS and other international bodies, and also the training in social work was arranged by COS in UK and United States. We all know about it. But my point is that many branches of social work has been evolved today. But one thing is that the issues of the labor rights. We are talking about international social work. We are talking about clinical social work. We are talking about radical social work. Though the issues of labor is part of the international social work in the age of globalization, because we know about it very well, how globalization affecting the lives of the working class people. But if we see the contribution, I mean the theoretical contribution of the social work academics, the issue of labor class community, I mean the one of the branches of labor welfare or industrial social work, it is lessly get attention by the social work academicians. Do you think about it? This is my one perception, that if we see all the contribution of the academics in social work around the world, we will find very little literature on the industrial social work or labor welfare. Though these issues was the starting point of emergence of social work profession. So what do you think about it? And if you think that yes, it is, do you have any plan? I think particularly Malcolm Payne, he had very wonderful contribution in writing the book of social work theories. And the recent book he edited possibly few months ago, we have found latest edition of his book. So it is my also request to say something about it, or if we have any chance to write about something on the issues in your forthcoming books. This is all from my point. Thank you very much.
Thank you. Professor Payne, Dr. Emeritus Ismail Hussain, he is currently the head of the department, social work, in a public university, Shah Jalal University of Science and Technology, and he is my direct teacher. So wonderful raising of comments and questions. So I request Payne just to take 2 minutes on just reply. Then I would request Chair, as we have just 10 minutes more to continue the session.
Well, just to make to connect the 2 points that have been made there. I mean, one of the things that is tremendously important is for social workers to create an identity for themselves as a profession and as an occupational group, and in the world more generally. And to talk about Dr. Hussain's point, currently I am writing a book which is entitled Why Social Work is Important. And because it's a book, there are a lot of things in it. But one of the things that I want to say about it is that a crucial contribution that social work makes from all the conceptions of social work that I've talked about today is that it is concerned with the social. It's concerned with interpersonal relationships, with intergroup relationships, and with institutional organizational relationships. And that is the contribution of social work to the politics and economics of the way in which we try to manage our societies. What we say as social workers, this is our identity, is that you cannot think just in terms of values, just in terms of economics, and just in terms of politics. You have to think about people's social relationships, and social work wants to give priority to the social and institutional relationships that people have and to working on them. And it's important to work on them and their resilience and their connectedness in order to make a society work successfully. And I think that should be the basis of social work's identity, both locally and internationally. And that means that you take account of local social connections and you take account of the global, regional, and national social connections.
Thank you, Prof, for a wonderful discussion. Now the time for session chair. I think Honorable Session Chair, Professor Mariko, you can conclude the session. And before concluding the session from our hosting, organizers, the message is, today we have another 2 sessions. First, plenary session will be started on just 2:40 p.m. Bangladesh local time, and it will be on next 2 hours. 5 plenary speakers will be, 5 plenary speakers. Professor Dr. Danisan Jaiseria from Malaysia, he will join, and Professor B.K. Ghosh from Vishwabharati University, West Bengal, he will join our next plenary session. Professor Salma Akhtar, she is Professor of Sociology, University of Dhaka. Ms. Deborah Ephraimson, she is American but currently residing in Bangladesh and Executive Director, Institute of Wellbeing. And Mentor Asif, Dr. Asif, he is currently the Chair and CEO of Lim Global Consulting. And as discussing panel, Mr. Mukhlis Rahman and Shukti Prabha, they will join us discussing. And before coming to chair, this is on behalf of me, my sincere regards to Professor Malcolm Payne. I cannot express my feelings really for you and for Professor Tiong. You just keep my words and requests, and you directly spending more than three hours. Actually, I cannot express my feelings. I'm honored for both of you, and Mariko is here. Mariko, since morning, she is with us, and all my respected professors are here. Really, you were just doing a fantastic work because you are the pioneer. You are the people whom we are following. You, Tiong, Mariko, and other professors here. So hopefully, the concept think globally, act locally, it's functioning. So we are getting some ideas that you are writing, you are disseminating different thoughts, different way. And I'm the little hope, I think just I'm the person, I'm just trying. Even sometimes I don't understand what I'm doing, but I have a heartfelt and full heart of courage and compassion for, definitely I shouldn't say my professors are here and other colleagues and friends are here. They all have together, but I love to see social work in a very prestigious position, because social work is a holistic, a comprehensive discipline which can heal, which can mitigate person, problem, personal, group, and community level. And you could find our organization name is Community Social Work Practice and Development Foundation. My YouTube channel name is Community Talks. My Facebook page is Community Talks BD. My Facebook group is Community Social Workers Network BD. And the newsletter name is Community Talks. So community is in our heart. And we do believe that Professor Tiong said, and Professor Tiong already wrote me an email, and I'm gladly accepting. Professor, I'm honored to appoint me as Bangladesh Chapter Coordinator of Global Institute of Social Work. Hopefully we could move forward, and if you would like to add a few points regarding your intention on me, how I can actually do work for the Global Institute, you can add before going to the chair, Honorable Mariko Kimura.
Thank you, Habibu. Through this session, thank you. I'd like to thank both Dr. Malcolm Payne and Dr. Tiong. Very encouraging, inspiring, reassuring the power of social workers. That Dr. Payne pointed out that the role of social work is indispensable, that because of our training, the social workers learn to work in different levels, connecting different functions. And that's really an indispensable function for the community and society to empower people to move forward. And Dr. Tiong's pointing out that resilience is really to change the style of social work to empower people, realizing the values and cultural values and in a cultural context that we really need to be evaluate and make it alive, so that the people would not be just limit themselves to live in a narrow society or community, but to expand and move beyond the border to change their lives. Thank you very much. I would like to close this session. Thank you very much for your active participation. Thank you.
Thank you, Malcolm. Thank you, Mariko. Thank you, Habibu.
Thank you. Back to you, Habibu.
Oh, sorry, I'm sorry. Just messages from our side. We are really honored and conveying gratitude, sincerity to all of you, to my team, volunteer, and so far we got a message. Our country might be closed or might be locked down for next week. It's not clearly declared, but we are just hearing. But session will be on, as this is virtual. Hopefully, you will follow our emails, our links, and Facebook. There are links already sent for all the sessions. Just do click on the link of the email on particular sessions. So please don't get disheartened, don't get nervous. And again, many thanks and heart full of love and affection, respect for our speakers, our honorable chair, all the distinguished speakers of other sessions after this till 6th of April. And on 6th of April at 8 p.m. to 9:30 p.m. Bangladesh session, there will be many guests. They're waiting to just make some remark on the closing session. Professor Briz Mohan from USA, Professor Adi from Indonesia, Dr. Antonina Daskina from Russia, and so many other professors will join with our all dignitaries, those who are here with Mariko even. So thank you again. Thanks a lot. Hope to see you just 2:40 today. Good luck, everybody. Thank you.